Joint cartilage is different from most tissues in your body. It has no blood supply. So when it gets damaged, it cannot heal on its own. If left untreated, the damage gets worse over time and seriously affects your quality of life. How to repair cartilage, how to make the new cartilage integrate well with the surrounding healthy tissue, and how to ensure long-term results. These have always been major challenges in treating knee cartilage injuries. That's where MACI comes in. MACI stands for Matrix-Induced Autologous Chondrocyte Implantation, a technique that uses your own cartilage cells to create a cartilage patch in the lab, which is then implanted back into your knee to fill the defect. Let's walk through the whole process. First, the doctor evaluates the patient and confirms they're a good candidate. Then, through a small arthroscopic procedure, the doctor takes a tiny piece of healthy cartilage about the size of a soybean from a non-weight-bearing area of the patient's knee. That tissue is sent to a special lab where the cartilage cells are isolated and grown in culture to multiply. Once there are enough cells, they are seeded onto a collagen membrane to create the patch. This whole lab process takes about 6 to 8 weeks. When the patch is ready, the surgeon opens up the knee joint and prepares the damaged area by cleaning it out, leaving only healthy cartilage of normal thickness around the edges. They then make a template of the defect, cut the MACI membrane to the right size and shape, and place it into the prepared bed. Fibrin glue is applied to the bottom and edges of the defect to secure the patch firmly in place. From the very next day after surgery, the implanted cells, now acting as seeds, start to grow, divide, and produce new extracellular matrix. Around 6 months later, the defect is mostly filled in. By about 1 year, the new tissue matures and hardens, blending seamlessly with the surrounding cartilage. With proper rehabilitation, patients can eventually return to a completely normal, active life.